Sense of hope, along with positive thinking, is more or less the driving factor to survive this global challenge. Nothing in life is to be feared, it is only to be understood. Now is the time to understand more so that we may fear less, as instanced by Marie Curie. Yali ho, I am Srashtita Chanda on behalf of Kerolix organization, a great bona fide association which understands that life can be challenging, but they approach the challenges with determination rather than defeat. Optimistically, they conquer whatever obstacles they encounter. I genuinely gratify the presence of respectable Dr. Kundan Modi, who is an acclaimed MBBS and MD. He pursued MD in gynecology in 2009 from MP Shah Medical College, Jamnagar. He has proficiently worked at the Mundra Multi-Speciality Hospital from 2009 to 2010. Now he is practicing in his private hospital, Geeta Hospital, since the last 12 years. As the rhetorician for the webinar, Pursuit of Positivity, he will convey us all about the precautions needed to be taken ahead to have a check forth on COVID-19. The waft of pandemonium is in constant stimulation on us in such wondrous ways that we could never have imagined. From unprecedented amounts of family time to homeschooling to working remotely or not working at all. The once a bustling neighborhood always reverberating with ear-splitting screams of kids playing across the society is now unified by an eerie silence. These sudden rapid changes in the way we live, coupled with uncertainty, the constant longing for things to go back to normal, have led to anxiety-driven, piercing noises in a human brain. These thoughts can fog our minds with worst-case scenarios, eventually leading to panic, obsessive compulsive disorders, or even depression. However, some conscious efforts of confidence boosting with a sense of optimism while taking one day at a time can go a long way. It may be tough right now, but you have managed those challenges in a beautiful manner. So life is a menu. Remember, whatever you order for your life, that is only going to be served to your table. Research suggests that in times of crisis, human relationships or connections stemming from virtues of trust and unconditional support help in boosting one's confidence and morale. So we welcome you in this Adore Friday webinar. Please allow us to understand more about the preventive and cautious ways for COVID-19. So.
Thank you. Hello. Good
Yes.
evening, everyone. As you all know, prevention is always better than cure. This is proven that when the infected person cough or sneeze, he emits virus with droplets in air. These droplets remain in the environment for few days to few weeks, okay? And it may become source of infection to healthy person by inhaling these droplets. It can be easily prevented by first, sanitation. Always wash your hand up to elbow with soap and water for 30 seconds frequently. Use alcohol-based sanitizer for cleaning surfaces like chair and table. Also, one can sanitize hands when soap and water is not available. Don't touch your face without sanitize your hands. Wash vegetables and fruits after purchase it from market and wash it again before consuming. The second thing is use mask. Mask must be covered nose and mouth fully. One should use preferably N95 type of mask which have 3 layers of cover and also nasal clip. Wear mask all the time when you are out of your house. Remove mask by picking from its ear string, not by picking from direct in front. And don't dispose mask in open, preferably burn it after its use. The third thing is most important is social distancing. One should not go outside unless it is very much necessary. And don't allow old age members and children to go outside. Avoid social gatherings and shopping from crowded places. Maintain safe distance of 1 meter while talking to other person, because many asymptomatic patients are nearby to you. Fourth most important thing is boost your natural immunity. You can do it by take heavy and healthy breakfast. Don't skip any meal. Drink plenty of water. Eat fresh fruits, pulses, salad in diet. Maintain personal hygiene. Take enough rest and sleep. Do mild exercise, yoga, aerobics, pranayam, etc. Whatever you like daily. And the fifth most important thing for prevention is vaccination. Take vaccine as soon as you are eligible.
Thank you so much, sir. Life is a shipwreck, but we must not forget to sing in the lifeboat. That's positivity. Each situation is unique and depends on who lives in the house and how vulnerable they are. Being vigilant of our mood in today's pandemic environment should be a priority to us all. Remaining calm and constructive at times of uncertainty can help us navigate through difficulties and find a path towards our more resilient self. My next concern to you, sir, what are the earliest symptoms of COVID-19?
Okay. If one can identify in himself early symptoms of COVID-19, then he can start treatment very early and prevent delayed complications. And also, it is helpful to minimize the spread of infection. So, the very early symptom of COVID-19 infection, as my routine practice I observed, it is weakness and giddiness. That kind of weakness that one is unable to perform his routine work. After 2 to 3 days of weakness, one may feel high-grade fever with or without chills or rigor. And fever is always associated with severe body pain. Loss of appetite, loss of taste and smell sensation, it will come after 3 to 7 days of weakness. And sometimes cough, cold, sore throat, they maybe come after 1 week or they might be absent in COVID-19 infection. So as per my opinion, weakness, severe weakness and high-grade fever and severe body pain are the most early symptoms of COVID-19. One should recognize it in his body.
Thank you so much, sir. So what should be done when someone is tested as positive?
Okay. If someone is tested positive, then first of all, don't be panic. Consult your doctor, listen him carefully, and start prescribed medicine. It is first thing. Then another thing is isolate yourself. Don't wander for small work they are left in. Don't wander and isolate yourself in your single room. Okay. Inform about your positive report to all your last week close contacts. Rest is very important, but not bed rest. Stop routine work and take leave from your office or job for 15 days. Wear mask all the time. It is necessary if possible. Drink plenty of fluid. Fluid reduce viremia, so drink plenty of fluid. At that time, your appetite is very low. So take small but frequent meals. Steam inhalation and gargles to reduce virus growth. It is also helpful. You should monitor your pulse, temperature, and SpO2 every 6 hours. There are many gadgets available in the market to monitor this SpO2, saturated pulse oxygen level. It should be more than 94%. But unfortunately, if you don't have that gadget, then a test I suggest you. It is 6-minute walk test. You can walk in a room, simple walk for 6 minutes. And if you feel giddiness or breathlessness after 6-minute walk, then there might be a SpO2 is less than 94%. So you should consult your doctor. And the most important thing is be psychological sound, engage yourself in your study, in your hobby, and be relaxed by watching some movies and old photograph album. Okay.
Brilliant, sir. Thank you so much. We know that if someone is tested positive, they have a lot of questions, and we want to make sure they have all their questions being answered. So if the world is crashing down before us and we eventually start wondering what to do next, first and foremost thing to do is go on for solitary confinement or isolation. The big thing available to us is the gift of this very moment. Instead of thinking aloud, what we need to do is to shift our focus to what makes us happy or what we are thankful for, and train our minds to think positively all the time. This will prevent overemphasis on negative thoughts that ultimately rob us of peaceful moments. My next query to you, sir, is what are the guidelines for the family members to be followed and emphasized on?
Family members are very much needed in this situation. They should give psychological support to the patient, transfer patient to a well ventilated and well maintained room. All other members of family must wear masks inside the home also. Children and old aged members should not allow to meet infected person. Only one young and healthy member should take care of patient, but by precaution. He should maintain some distance with patient if possible. The caretaker person should wear gloves, mask, and face shield also. And caretaker should wash his hands very frequently. The family member should maintain record of fluid and diet intake, consumed medicine, and lab reports and doctor visit records. And family members should monitor symptoms of patient like high grade fever, giddiness, vomiting, breathlessness should be monitored and inform doctor as soon as they are severe. They should encourage patient to do some aerobic exercise, yoga, pranayama, and use disposable items for the patient, like this is for food and a paper napkin for cleaning the room. And after the use of these items, dispose them items in a safe way.
Okay, so in this pursuit, I would like to quote the words of famous activist and actress Angelina Jolie. Life comes with many challenges. The ones that should not scare us are the ones we can take on and take control of. In fact, we are so bogged down with our office or business daily routine chores that we completely miss out enjoying the nuances of life. We are in the habit of running behind a number of pseudo passions and crave for success in the process. Ignore the niceties of day-to-day life. What we miss out may be inconsequential for the growth of our success, but it does not matter a lot for those who form part of our family. The habit of wanting everything is set to undergo a sea change in the coming days, as we have caught up with the thought of distinguishing our wants from needs. The orientation towards moving to confine to our needs rather than wants is now uppermost in our minds. Doing the best at this time or this moment puts you in the best place for the next moment. Good nutrition is crucial for health, particularly in times when the immune system might need to fight back. My next query is about importance of diet and rest for everyone, people suffering from the wrath of the virus, and even for the normal people who can get affected by the consequences. Yes, sir.
Diet and rest, they have very important role in the battle against any disease. Take heavy breakfast, and breakfast should include seasonal fresh fruits, sprouts, green vegetables, and salad. Don't skip any meal. Drink minimum 3 liters of water per day. Avoid excessive sugar and oil in diet. Take small meal between lunch and dinner. You can take a orange at 4 p.m. It boosts your immunity. Exercise should be in your routine. You should do daily 1 hour walking, jogging, cycling, aerobic exercise, whatever you like for fitness. And yoga, pranayama, and deep breathing exercise for maintain natural immune power to the body. And another thing is rest. One should take minimum 8 hours sound sleep to recover stress from the previous day. Okay, and one should take half-hour break from his 5-hour job. It should be encouraged for mental health also.
Thank you so much, sir. Actually, the misanthropic situation has made us reflect on many assumptions that we hold close to our hearts. On the contrary, it has brought individuals from across the planet, irrespective of status, wealth, age, or citizenship, to come together with a common purpose. This standoffish break has taught us to evolve, upgrade, and accept the realities of life with a high degree of talent. Do what you can with what you have, where you are, as reinforced by Theodore Roosevelt. So my next important and germane query to you, sir, what is plasma donation?
Okay. Plasma is a part of a blood without cells. It mainly contains antibodies and proteins to fight against any organism. The plasma of a healthy but previously infected person may contain that much amount of antibody which can fight against virus. So it was previously thought that if that plasma will transfuse in a severely ill patient, then it may help to recover patient and it helps in some disease also. But after our clinical experiences and ICMR recent guidelines, this treatment is not effective in COVID-19 treatment. Moreover, chance of blood-borne infection and virus mutation is greater in plasma transfusion treatment. So generally, plasma donation is not advisable.
Okay, sir. Truly, I give you a big thank you for making us understand the crucial need of the hour and how shall we move forth to make other people survive. Actually, this reclusive and pathetic circumstances has offered us an opportunity to learn and unlearn certain things and thus get reintroduced to ourselves with a different perspective. This period has offered us space for growth, flexibility, and reformation in our minds and thoughts. I strongly believe at the end of the day, we will emerge as a new persona, rebuilding our identity and adopting new practices and habits, which will enable us to cope and turn moments of anxiety and despair into one of hope and perseverance. The thought of being together has blossomed in our mind, and it's up to us to adapt to positive and lateral thinking. It is apt to quote here the Roman philosopher Seneca, who said, "We are waves from the same sea, leaves from the same tree, and flowers of the same garden." And that must always be in our mind now and forever. The pandemic has impacted almost every corner of life, causing global economies to stall, changing the way we work and interact with our loved ones, and stretching healthcare systems to the limit. So, please demonstrate the importance of vaccination.
Yes. Vaccination is a game changer in this pandemic. Everyone who is eligible for this should take it. At present, two vaccines are available in India, Covaxin and Covishield. They are given as an intramuscular injection at deltoid region in two doses. Interval between two doses in Covaxin is 4 weeks and in Covishield is 8 to 12 weeks. And almost 85% immune response is observed. That means 85 out of 100 vaccinated people will achieve enough antibody level in blood after 15 days of completion of second dose. There are some side effects of vaccination. There are local side effects like redness, swelling, and pain at the site of injection for 1 to 2 days. It will resolve itself. And some systemic side effect like fever with rigor, weakness, body pain. It is observed in almost 35% cases for first 3 to 7 days after vaccination. It is advisable to take rest for 3 to 7 days after vaccination and observe for side effects. If one can see this very much side effects, then he should consult doctor in as soon as possible.
Sure, sir.
There are some other guidelines for special cases like pregnant ladies and children less than 18 years should not take vaccine, as vaccine for this group is under trial. People who recovered from corona infection should take vaccine after 4 weeks of negative RT-PCR report. People who have diabetes, hypertension, cancer, and some chronic illness should take vaccine, but they should be monitored for their side effects. People who are in ICU, chemo or radiotherapy, or who has low immunity, should take vaccine after 4 weeks of their recovery. And women who is breastfed to her child and who are menstruating can take vaccine as routine. There is no prohibition for that.
Thank you so much, sir. Thank you so much. Actually, educating people about COVID-19 vaccination, I think it will help to build trust in the decision to offer vaccinations more. And being transparent about the development of the vaccine, along with the prevalence of potential adverse events without which the world will not be able to overcome the pandemic and return to normal life. So when it rains, look for rainbows. When it's dark, look for stars. Exactly. Oscar Wilde, you might have thought it. So when the world, as we know, it has gone for a toss, it is quite difficult to emerge positive. We are surrounded by doom and gloom, filled with news of deaths and ailment. To be able to stay positive in such hard times, take every ounce of energy within us. Since most of the news associated with the virus talks of how the virus is inversely affecting major cities, businesses, economies, and the life count, it is fairly easy to be lost in all the negativity and drastic long-term changes it brings. So my evident approach to you at last, how to stay positive within the negativity.
See, I have seen many people in depression, phobia, OCD in this pandemic. It is mainly due to fear of falling ill, fear of death, fear of losing job or business. But fact is that 95% of COVID patients recovered with minimal treatment and may not need any ICU support. So acceptance of infection, seeking early advice, and from good level of health home-based care, many patients may recover. So don't worry about it. Another thing is in lockdown period, everyone has to stay inside home, and which was never expected and never experienced. So, and we don't know what happened next. So everyone is anxious and panic situation everywhere. So take lockdown period or isolation period.
Yes, sir, please continue.
You can draw painting, sing songs, play on guitar or harmonium, plant vegetable and flowers surrounding to your house, read motivational books and novels, watch movies, rememorize your past by
Making photo albums, do video call to your dear ones, play indoor games like carom and chess, spend time with your children. You should avoid the negative news and rumors. So stop excessive use of social media. Even don't watch news channels for a long time. Personally, I am using YouTube to improve my drawing skills. You can make a group on Zoom or this similar platform and do yoga, pranayam together. So everyone is motivated by each other. And after all, if you have symptoms like excessive crying, excessive worrying, sleeplessness, excessive thinking about bad things, then you should consult your psychologist for counseling and sometimes treatment without hesitation.
Truly, sir. You are strong, then you know. It is fairly easy to be engulfed in the hopelessness that the pandemic brings with, but hope goes a long way. Hope is what keeps us going. Dumbledore was indeed right when he said happiness can be found even in the darkest of times if one only remembers to turn on the light. Life imposes things on you that you can't control, but you still have the choice of how you are going to live through this. Stepping to the conclusion of the eminent program, thawing salutation to the sleep-deprived heroes, including doctors, nurses, medical cleaners, pathologists, paramedics, ambulance drivers, and healthcare administrators. In the fight against coronavirus, the brave medical army stands strong with the thermometers, stethoscopes, and ventilators as their weapons. Do not forget, medical researchers are working day in and night out against all odds, hoping to find the antidote to the disease. Every day, the selfless warriors are giving their all in healthcare settings while cutting themselves off from their families and loved ones. The sacrifice that they are making for the safety and welfare of humanity is priceless and deserves lifelong gratitude on our end. Words are really less to show my gratitude towards you, sir. I bow to the endless and sacrificing efforts taken up by you to eradicate the pathetic situation to a normal. Thank you again.
I thank the Calorex group for giving me this opportunity to reach out to the community by sharing my thoughts. Thank you.
So to lose patient is to lose the battle, as stated by Mahatma Gandhi. So stay hopeful, stay connected. Hope is the patience with which we need to lamp the light. Namaste.